Hi YouTube, welcome to the summary of the 5th week of my 4th year in medical school. So I'm still doing family med. I have 3 more weeks of it, or 2 more now, and it's going great. As I left off, John got injured on Sunday, and so starting Monday, he was pretty much laid up in bed. We read about it, and you're really supposed to do like nothing, just rest up for the first few days of an injury. And so he, poor him, had to stay home, and I went, which is fine because I'm used to being like the only medical student with the doctor. But it was a busy, hectic day. I think he was scheduling more patients because he knew that we were going to be there, and this is Mondays. I have to keep track of like my patients and what I've seen. So I have 13 patients, which I know probably doesn't sound like a ton, but like these are patients that I saw on my own, did the HPI, did everything, reviewed everything, did their exam, and went out, talked with him, staffed it, went back in with his okay, did the assessment and plan and everything. So it was crazy. And at noon, he was able to get in with the orthopedic surgeon for him to see if he needed any further testing like an MRI or surgery, which we were not hoping for. And good news on that is that he didn't. They don't think he tore it right where it attaches up at the bone. They think he tore it more where the tendon and muscle meet. So it still sounds awful, but it doesn't need surgical, it doesn't need cadaver tendon, it doesn't need anything. So just he needed to go to physical therapy and just try to heal on his own. And so we set up for physical therapy for Tuesday. But anyways, that was over the lunch hour. I did that and then saw other patients. Also, John was going to go in with another doctor and help out with the C-section on Monday morning, and he was all pumped because I'd been on, my OB-GYN rotation was like awesome. I was always scrubbed in on C-sections and helped out, and actually we didn't have that many, which was awesome because I liked helping out with the vaginal births more. So he was going to do a C-section Monday morning at 7:30. But of course, Sunday night he couldn't. So he's like, you have to take it. And I was like, I was a little bit nervous because with this doctor, our doc said, like, make sure you practice your knots. She always complains that her students don't know knots and can't do them. So I was like, shoot, last minute I didn't get to practice my knots, but whatever. But it's silly how I'm still a 4th year and still get nervous about things like that. I was like terrified that morning and made sure I had a good breakfast and was there early, and I still was nervous. And it's new OR, new people, new scrub nurses, and just a whole new atmosphere. So I was nervous, but it all went well. It was actually really fun, great to be back in the OR. I haven't been there since I think April or May, and so that was fun. I scrubbed in just fine. It's like riding a bike, you just remember, even though I was nervous. And she helped me do quite a bit. She obviously did the cutting and got the baby out, and it was a scheduled one, so it wasn't like an emergent, scary situation. And there's another doc to take the baby, which I always feel so bad because I love when the baby comes out, I want to like help resuscitate it and cut the cord and bring it over and do the newborn exam. But it's like, oh wait, no, I'm wearing like the OB hat over here, not the either family doc or Pete's doc hat. So that's always hard. You hear like the baby over there and they're like talking about APGARs, and I'm like, oh, I want to be over there. But then I'm over here and I love being over here too, so I'm always torn. But anyways, so that was really fun, and she let me help close. She did the first, and then actually she let me pull out the placenta, which is really interesting, and you get to feel the inside of the uterus when you get to, because everybody talks about this, oh, you know, the sandpapery feel of the uterus, especially if you have to go and do a manual extraction of the placenta, which you never want to do, but you should know how to do it in case you need to. And it's like the sandpapery, like scrapey kind of feel, and you had to go in there and like scrape off the placenta, which is totally, I've never done that before. So that was interesting, and pull up placenta and everything was great. And she closed the first layer, and then she does a second layer close on the uterus, and she let me do a few of those stitches. I think, yes, she did. I'm trying to remember. all the different layers. And she closes the muscle, and so actually that was a pretty easy one. She let me do most of that one, and that's when I had to do my one-handed ties, and I was super nervous. And right before we were waiting to go in the OR, she kind of untied her scrub ties, and I did mine, and so we're sitting there and she's like overviewing. I'm like, I think I'm actually better at my one-handed tie, the one I could remember, and so I would, practice that, and it's like riding a bike. I was so nervous that I couldn't remember how to do it, and I hadn't probably done that in months or a year. We had a surgery class at our med school where we learned all the different suturing techniques and knot tying and everything, but I'd never really done it on a real person. I've done instrument tie like a bazillion times, but not really one-handed or even a two-handed. I like the one-handed better anyways, so I guess it's probably good. Anyways, but you're using like chromic gut on the muscle, and it was like sticky, and I'm like, it was like awful, and I thought I was doing a bad job. And what else was I closing? I was helping her tie a knot, I think, on the fascia close. And I was so proud because then she's like, wow, like, have you been practicing this? Like, you're our best student that we've ever had. And I was like, oh, thanks. I felt like I was doing a horrible job, but she's like, yeah, she actually knows how to do her knots. So yay, I felt pretty good about that. And so I got to help close the fascia and the subcutaneous tissue, and then she does subcuticular running on her close of the skin, which is always more beautiful than the staples. But that is the one that I need practice with. I feel so slow, and you're trying to get it to match up, and you have to just get it, right in the skin layer and come out at the perfect spot, and you can't let it, I need to practice it, and I feel like, I don't know, I can't just stitch into anything. It's just a different feel having to work just with the skin. But anyways, that was that, and it went pretty well. I was really nervous, but it was really, really fun. I loved it. Let's see. So that was that crazy busy Monday. That was all on the same day. And then Tuesday, John was still supposed to lay low. He went to his physical therapy, and he was like on crutches, and I felt so bad. He had to like crutch across the hospital, and he was like dripping in sweat because he like could not put any weight on it and had to be on his crutches. And he went to his physical therapy appointment, and they told him, they did like ultrasound and some stretches and massage and stuff. I don't know. I wasn't there, so I don't know. And they told him that he can try, as long as it doesn't like kill him, to try to put some weight on it just a little bit more and more, to try to see how much he could do. And sure enough, he went home and kind of was trying it and just kind of straightened it out. And he could actually walk if he found he could straighten his leg out, which hurt a lot, I guess. But as long as it was straight, it didn't hurt him. So he just kind of limped along with one straight leg, and he didn't need the crutches. And so here he appears at lunch with nothing, and I'm like, whoa, what happened? What are you doing? He's like, I'm ready to go back to clinic. He was in his, button up with his tie and in his clinic clothes. I'm like, okay, sure, we could definitely use your help. And so we went back, and he came back to work. He found out he really has a hard time not doing anything. He's like, I hated it. Monday was so boring. All I could think about were all the patients I was missing and the cool things we were seeing. And he's like, it really reinforced that I really want to be a doctor and really want to do family medicine, because I sat at home and all I could think about was being there and helping those patients. So at least I learned that. So yeah, rest of the week is kind of a blur. I think Tuesday we were on call. No, Monday. Yes, Monday we were on, I'm getting this wrong. I can't remember. We were on call one day, and then we ended up just having one patient in the hospital, which was kind of just right away after we were done with the clinic. He let us work it up, do the H&P, physical, write up our own orders, what we thought should happen, and then we called him in. He came up and did the same and kind of fixed our orders, and that was, it was an upper GI bleed case, so that was, good to go through. I think I've already worked up one or two of those in my internal med rotations, so it's good to see that again. And I don't know, it's exciting. Even though I've already seen upper GI bleed, there's always different parts to the story and different keys to this different situation. Someone might have renal failure, or maybe they're, have to. Anyways, it's so different, and I love it. Hence, I'm in doing this, but. Let's see, and then luckily we had nothing else or unfortunately or fortunately, we had nothing else that night, so we slept the whole night. We thought we would have been called to do an admit, but never was. So the rest of the week, we saw on average, depending on the day, 1, 2, 3, 4, 5, 6 to 4 patients, 5 on my own. You know, I would maybe go in and see other things. And some of the patients took a long time because there's a doc that left and we were taking over their patients, and so we kind of he wanted us to do like a whole chart review on them and really get down to everything and kind of really clean it up and fix it up. And so that always took a little bit of time, but it's kind of fun to do anyways. Oh, and we saw a vaginal birth. John and I were both just there. We didn't actually get to help out much with it. John got to do some cord blood collection to be sent off and to be banked for the cord blood bank, which I've never seen done, and he's never done it either, so that was interesting. And let's see, I have my list here. See anything cool? Just kind of normal stuff. On Friday, he let us leave on a half day because we traveled up to see our family for another family reunion, this time my dad's side of the family. So we were up at my parents' cabin up in northern Minnesota, and we left Friday. It's like, it took us like 7 hours. We ended up stopping in a town where John's aunt and uncle lived, and we said hi to them, and it was beautiful though. I love driving. We're not on any freeways, we're just on highways, and it was gorgeous. I love it. And got up there on Friday night and hung out with family, and it was just fun. Went out jet skiing and went out on the pontoon and just kind of hung out. Got to catch up with all my cousins and aunt and uncles that I don't really get to see that often. And I actually went golfing on Sunday. I haven't been golfing in 2 years. Not my favorite thing to do, but my family is obsessed with golf, so I had to. And so we went out and played 9 holes, and John was really excited. He ended up playing 2 18-hole rounds, which I know, right, with his hurt hamstring, he was doing pretty good by then. Now he's a nasty bruise actually in the back of his thigh, but yeah, I did that, and then our doctor he gave us Monday morning off so that we could do the 7-hour drive Monday morning, come back, shower, have lunch, and then meet back at clinic at 1. So that was really nice that he let us do it. So that's pretty much the summary of our week. We need to get our butt in action to start studying. We have our COMLEX Level 2 boards coming up, the PE, so we have to fly out to Philadelphia to take the test where we see like 12 patients and have to write the note and everything. We need to start working on that. We have the books. I've kind of read through it. We need to start doing some mock cases and practice because, but I do feel like we're getting a lot of practice. I mean, what am I doing every day? Oh, I'm pretty much practicing for the exam. However, not the time limits, and I'm not writing my note. I'm typing it in a computer. So I do need to spruce up to make sure I can do it in the time limits. I think that's going to be my biggest concern. I think the patient contact, patient communication, hopefully my differentials and my thought process, hopefully I have it all there, but I need to work on the timing. Also, we have our ARIS application that we signed up for, and I need to get working on that. I need to get that all done. Our goal was to have it done by the end of this rotation, which is kind of end of July, beginning of August, so I need to get working on that. So anyways, that was our week. Again, loving family medicine, loving the little town I'm in. It's been awesome. And more every day, it's like I could see myself doing this. So anyways, hope everyone's doing well.